Hello world, and welcome back to my channel. I am Dr. Rana, and today I want to talk about a very special moment and a very special case that I recently did that had a tremendous impact on my patient, me, and everybody involved. This case I hold very close to my heart because the patient was 20 years old and he presented with full upper extractions and a full upper denture, and I had to talk to his mom about it and had that conversation with him. And it was a really difficult conversation, but in the end of the day, it was the best for him. Now, before I get started, if you're a dental student, somebody considering dentistry, or even somebody who's a dentist now, please drill into that like button and subscribe. Share this with a friend of yours. Anybody who may want to know the impact that you will have one day as a dentist, or if you currently are, the impact you're making every single day on patients' lives. My goal for making this channel was to spread awareness to the world of the beautiful parts of our profession, the impact we have on our community, and the amount of lives we touch on a day-to-day basis. And if you'd like for me to narrate more of my surgery cases or talk more about clinical presentations, please leave a comment down below. Reach out to me on Instagram if you need to. I'm always here for you to have a conversation and to get to know you a little bit better where you are in your own journey and how I can get you to that next step. Now, I know this case may seem a bit graphic and gory. However, I want to take this moment to bring you closer, step inside the operatory, and see the complexity of surgical work that we do as dentists. Hopefully after watching this video, it can inspire you to get through that tough week of exams you may be going through, or if you're still trudging through for the DAT, it'll get you to that next hurdle and get you to that next step of becoming a dentist. All right, let's get started. Patient presents as a 20-year-old male with excruciating 10 out of 10 pain on his upper left molar. Says he complains of pain and sensitivity from cold drinks and biting. Upon clinical examination, patient has ramping caries throughout his entire mouth. His last dental visit was 7 years ago for a tooth extraction. Patient's smoking history can give clear indication to sometimes why these rampant caries are present. And in his situation, he's been smoking marijuana for the majority of his life and also a half a pack of cigarettes a day as a 20-year-old. Patient denies any further drug use, and we took his blood pressure. It was around 139/82, all within normal limits. His social habits, he states that he brushes once a day and doesn't ever floss. And he also does consume a lot of sugary snacks and beverages, mainly Monster energy drinks. And I always tell my patients, those are the killers for your teeth. Those energy drinks are like battery acid for your teeth. So I'm always warning them, and hopefully you do the same for your patients. So after sitting down with him and his mother and having that conversation, it really touched my heart to get to know him. He says he struggled with confidence his entire life because of his smile. His mother was telling me he can't get a job because he's too embarrassed to go out in public and show the world who he really is. And his mother is such a sweet lady. She told me that this surgery is exactly what he needed at this time in his life to make a positive impact and change his life for the better. And stay tuned towards the end of the video where I show the mother's reaction to her son's brand new smile. She is in shock, and you don't want to miss that, trust me. It literally made me feel like I was crying inside. So the treatment plan goes as follows. Full upper extractions, full upper denture, posterior lower extractions, partial denture on the bottom. I try to offer the best treatment for him, and it was a 4-implant maxillary overdenture, but due to financing, patient's mother declined and elected to go with the immediate upper and immediate lower, partial and full. I also tried to creatively brainstorm about the best way to restore as many teeth as possible and work with what we have to not have to resort to dentures, but the level of decay was too rampant and I had to bite the bullet and just go forward with the complete upper denture. So upon pre-op x-ray examination, I knew this was gonna be a tough case. Guys, if you've seen a case like this with that level of decay for surgeries and extractions, it's gonna be a nightmare. So definitely buckle up, get ready, and let's see what happens. So let's talk anesthesia plan. For me, I love using Septicaine. It's so much more effective than lidocaine. So I'm always using Septicaine for my infiltrations, and I'll use lidocaine for blocks. When I'm doing big surgeries like this, I'm typically using 2 syringes at the same time in terms of me using one while my assistant is loading the other one. So it's much faster for the patient. I'm using one, the other one's ready, we switch, she's using the other one, and then we're just switching like that. So that way the whole anesthesia process is much faster for the patient and they're not really realizing what's happening, which is the worst part for them in terms of getting injected. All right, so how am I tackling a case like this? I'm using the Karl Schumacher Proximator. It's a spade proximator. It's my favorite oral surgery tool I've ever used. It's got a really sharp point and it's a really strong instrument that you can kind of get in between the PDLs and separate all of that stuff out the way, move the gums out the way, and it's much more effective than using just the periosteal elevator or just the 301 elevator. Most dentists I know like to use the periosteal to reflect the gums, but I think using the Karl Schumacher is a 2-for-1. I get to move the papilla out the way, I get to dig into the PDL, and it's much more effective for me in my hands. So as I'm going through the PDL of each tooth, I'm getting a bit of retraction and elevation as I'm going down the whole arch. I try to get a little bit of each tooth on the way out. That way I am causing bleeding in the site, which is able to push the tooth and give it a little bit of force, hydraulic force, into the socket where it makes the tooth a little more mobile than normal, so I can get better grip on it with the forceps when I need to, or elevation with the 301. I always like to go for the easy teeth first, teeth with big crowns, less decay. I'm doing the 301 interproximal, I'm trying to get some elevation, and if it's moving, I'm gonna grab it with the forceps. If not, we gotta go to the next step. And to be honest, this surgery was quite messy. There was a lot of decay and it was a very tough extractions all the way down the arches. So as you may have guessed, a bunch of these teeth broke. And what do you suggest we do when all these teeth are in the bone now, decayed completely under the gums? Well, Dr. Rana has an answer for you. And the answer is the almighty flap. Guys, flapping is a game changer. Once you master it and get a better grasp of what it actually does for you, it changes your surgeries night and day. It is the best thing to master first when tackling oral surgery. Guys, I'm using a 15 blade. I'm going straight to bone. I'm giving nice contact through the periosteum, and I'm using that number 3 pen handle grasp. It's a much better tool, and I get much more ergonomics out of it when I'm moving that blade through the arch. I highly recommend you look into that tool. Also, I'm going mid-keratinized tissue. I want to preserve that amount on the buccal just in case. That's always a go-to technique for me if I'm ever doing implants or full arch surgery. Not going mid-crestal, I'm going mid-keratinized tissue. There's a difference. Now, once I've completely made that incision, I'm using that periosteal to get in between and move the gums out the way, getting deep to bone, getting under the tissue and moving it out of the way. And now I have a much better visualization of those root tips and those broken teeth down into the bone. And as I'm making my way down the arch, once I have 4 or 5 teeth left, I'm blocking the bottoms. So that way, all the anesthesia is not given at once. Sometimes what happens is if you take too long up top, it starts to wear off on the bottom, and then you gotta give more anesthetic, and then you find that you're reaching the upper limits, and it just becomes a complicated process that doesn't need to happen. So as I go through the arch, I'm blocking the bottoms, giving those infiltrations as well once I have a few teeth left. After watching countless amounts of oral surgery procedures done by oral surgeons, what I've recently started doing is sculpting the bone with the 161 burr. I do this in my clinical practice because it shapes the bone nicely and it prevents any bone spurs or bone spicules from coming out through the gums and causing some post-op pain afterward. I know a lot of dentists use rongeurs and bone files. I do like to use a mix of those things, but I always realize that the drill gets me that nice contour that I'm looking for. Plus, patient ever wants implants down the road. It makes it easier with a smoother ridge to be able to place implants as opposed to a ridge that was left with a lot of interseptal bone that's very sharp poking out the gums. Also take note, I'm rarely touching the buccal bone with that burr. I stay away from buccal bone. That is a huge principle in oral surgery, implantology. I'm avoiding that. I'm saving as much of that as possible. Guys, just as a caveat, I'm not an oral surgeon, I'm a general dentist. So did I do this case to the clinical expectancy of an oral surgeon? No. But was I able to deliver quality care to a patient who couldn't afford to see the oral surgeon? Yes. And at the end of the day, I felt really happy that I was able to make a positive impact on this kid's life through my surgical skills and my abilities that I've learned through school and work as a general dentist. And here's a pic of the sutures. When I'm doing full arch surgery, I'm typically doing a continuous interlocking from one end to the other with some single interrupters over the top to make sure it's nice and tight and I get good primary closure for good optimal healing. And here's a picture of the immediate denture. It's not his finals and it's not a perfect denture, but it's something that's gonna get him through the healing process and it'll allow him to learn how to live life with a denture, and it's really important for him to keep that thing in, as you should tell all your patients. It acts like a band-aid. It prevents swelling and it'll keep the bleeding to a minimum. All right, now here's for the grand finale. Here's the mother's reaction to her son's brand new beautiful smile after seeing all that decay and all the negativity that was associated with his smile. She was absolutely shocked, and it brought such a big smile to myself and my assistant, and it was just life-changing stuff, man. I'm telling you, seeing this kind of work makes it all feel worth it. All those struggles that I went through to get into dental school, take the DAT, all those rigorous exams and practicals, graduation, looking for a job, everything was worth it in this moment of mine when I was able to make an impact on my patient. Came in today with just a lot of decay, a lot of infection in his mouth, and today we kind of changed his life for him. And I wanted to show you what it looks like now. Yeah, it's absolutely incredible the work that we can do for him.
Yeah.
Right?
Oh my God.
I'm so happy we can do this for him. He's such a good kid, and it's kind of amazing. All right? You did great, man.
You did awesome.
Oh my. You know what my son said? He gonna be on his shit now. He gonna be on his shit.
It's amazing the way he came in and the way we're leaving today. It's a new chapter for him, and it's a new life, honestly.
Wow.
He's gonna be so much better off.
Wow. I mean, I don't know what to say.
He did great.
Wow. So the next one's gonna look just like that.
Yeah, better. It's
Better.
gonna be more real looking, better fitting.
Yeah. Those look real.
Those look real too. Wow, what an incredible reaction by his mother. That was just the dopest thing. She was like, he gonna be back on his shit again. I was going crazy. Oh my goodness, that moment was so tender and so special to my heart. And in conclusion, guys, I just wanna say that I'll always remember this case for the rest of my life. And I remember seeing him for the first time. He was just a young kid looking for guidance and looking for help out of a situation he let get out of hand. And I know when you're young, we don't always make the best decisions, and a lot of people are dealt with different cards. And I understand that, and I'm happy he came to me, and I'm happy we were able to deliver the care he needed. I look forward to seeing him at his follow-up appointments and seeing how he's adjusting to that life with dentures. Now, I told him it's gonna be an adjustment, but at least he'll be able to smile in front of his friends and family in those really special moments of his. Lastly, I hope you guys appreciate the level of vulnerability I'm having here in showcasing the world surgery cases as a brand new, fresh graduate dentist just coming out of school. It takes a lot of effort for me to make these videos and put myself out there for the world to see, and I hope that it can inspire the next generation of dentists, or if you're going through school or you're currently a dentist, it'll get you through a tough time in your life to really see the impact we can make on our patients and our community. So please drill into that like button, smash those comments if you can. Tell me about how your surgeries are going. Tell me if you're being able to make an impact on your patients, and keep in touch. Please reach out to me on Instagram right here. I'm always here to help you in any step of the way. As always, guys, Dr. Rana checking out.